Anti-asthmatic drug. Asthma is a chronic respiratory disease characterized by airway inflammation, hyperresponsiveness, and obstruction. The pathophysiology of asthma involves multiple complex mechanisms that interact with each other, leading to the characteristic symptoms of the disease. Airway inflammation. In asthma, the airways become inflamed due to the presence of immune cells, such as eosinophils, mast cells, and T helper type 2, Th2, cells, which release inflammatory mediators, such as histamine, cytokines, and leukotrienes. This inflammation leads to the narrowing of the airways and increased mucus production, making it difficult for air to pass through. Airway hyperresponsiveness. In addition to inflammation, people with asthma also have increased airway hyperresponsiveness, which means their airways are more sensitive to irritants such as allergens, pollutants, and cold air. This hyperresponsiveness can lead to the sudden onset of asthma symptoms when exposed to these triggers. Airway obstruction. The combination of airway inflammation and hyperresponsiveness leads to airway obstruction, which is the hallmark of asthma. The airways become constricted due to the inflammation and excessive mucus production, making it difficult for air to pass through. Remodeling. With long-standing asthma, airway remodeling may occur. This involves structural changes in the airway walls, such as increased thickness and smooth muscle hypertrophy, which can contribute to persistent airway obstruction and airflow limitation. Overall, the pathophysiology of asthma involves a complex interplay between inflammation, hyperresponsiveness, and obstruction, leading to the characteristic symptoms of the disease. Effective management of asthma involves reducing inflammation and hyperresponsiveness, and relieving airway obstruction to improve breathing. Anti-asthmatic drugs are medications used to manage and prevent the symptoms of asthma, a respiratory condition that causes inflammation and narrowing of the airways, leading to breathing difficulties. There are several types of anti-asthmatic drugs, which can be classified into the following categories: methylxanthines, theophylline, aminophylline, doxorubicin. Bronchodilators. These drugs relax the muscles that surround the airways, allowing them to open up and ease breathing. Bronchodilators can be further classified into beta-2 agonists. These drugs activate the beta-2 receptors in the lungs, causing the airways to widen. Short-acting beta-2 agonist, SABA, salbutamol, terbutaline. Long-acting beta-2 agonist, LABA, salmeterol, formoterol, albuterol. Anticholinergics. These drugs block the action of acetylcholine, a neurotransmitter that causes the airways to narrow. Short-acting muscarinic antagonist, SAMA, ipratropium, oxytropium. Long-acting muscarinic antagonist, LAMA, tiotropium, glycopyrronium. 2. Anti-inflammatory drugs. These drugs reduce inflammation in the airways, which helps to prevent asthma symptoms. Anti-inflammatory drugs can be further classified into inhaled corticosteroids. These drugs reduce inflammation in the airways by suppressing the immune system. Examples include fluticasone, budesonide, and beclomethasone. Leukotriene modifiers. These drugs block the action of leukotrienes, which are chemicals that cause inflammation and narrowing of the airways. Examples include montelukast, zafirlukast, and xileuton. Immunomodulators. These drugs modify the immune response in the body to prevent inflammation in the airways. Examples include omalizumab and mepolizumab. 2. Combination drugs. These drugs combine both bronchodilators and anti-inflammatory drugs in one medication. Examples include fluticasone, salmeterol, budesonide, formoterol, and mometasone, formoterol. It's important to note that the classification of anti-asthmatic drugs can vary depending on the source, and some drugs may belong to more than one category. Additionally, the choice of medication and its classification will depend on the severity of the patient's asthma and individual needs. Thanks for watching.